Hello and welcome to the second instalment in this series of podcasts, which is going to focus today on infection. Podcast 1 has looked at pain, and we're going to deal with the problem of infection in this second podcast, charting how it's developed over our time period and considering the factors that are actually causing that pain. Now, before antiseptics were discovered and identified, many patients obviously died from infection. Germs and bacteria would get into the wounds and they would get gangrene or other sorts of infections like blood infections, which would then lead to death. And this was largely down to a series of factors, largely the conditions that operations were undertaken in. Doctors' work clothes, their overalls, would be covered in blood and pus. It was actually seen as a positive thing, a good thing, if a surgeon had lots of blood and pus all over their apron, because it would show the experience that they actually had. But obviously this would contain a huge amount of germs. They didn't wash their hands, or if they did, it was very, very rare, and this was largely down to the fact they didn't understand germs. And finally, hygiene conditions for operations were generally very, very poor, unhygienic, and a lot of the time these operations would not even take place in hospitals but people's homes, showing the unhygienic conditions, the unsterilised conditions that we would know today. Now, before our time period, 1850, that's not to say that there were no attempts to try and solve this problem of infection, or that there wasn't any acknowledgement that there could be a link between perhaps dirt and patients dying. We've got two particular individuals who noticed this. The first was Semmelweis, an Austrian doctor in 1846, who noticed that death rates were higher in childbirth in hospitals, particularly his hospitals, and specifically where medical students were involved. And he noticed that this was because the medical students would come straight up from their dissections in the mortuaries onto the wards and into the delivery rooms. And what he made them do was wash their hands, a very simple act of just washing their hands with warm water and soap. And as a result of that, death rates within mothers in childbirth reduced within his ward and within the hospital. Now, although this seems like a really positive and logical step with really good results, attitudes and beliefs of other doctors actually led him to be fired, and there wasn't this idea wasn't widely communicated or accepted. So we see factors such as attitudes and beliefs here negatively impacting upon infection being solved earlier. A second individual, though, who is more positive in trying to solve and develop the problem of infection is Florence Nightingale, who's not a doctor but a nurse. She highlighted the importance of hygiene standards when she went to Scutari in the Crimean War. One of the main things she did within that hospital to lower the death rate so significantly was just to make sure the hygiene conditions within that hospital was clean and healthy, making sure one patient per bed there was fresh air coming in and out, that beds were regularly changed, that the environment was regularly cleaned. And although this was not down to her understanding germs or later wanting to believe in germs, it was actually down to her belief in miasma, bad smells, that led her to create these hygienic conditions. And she actually published, when she came back from Scutari, notes on hospitals and created a model hospital which promoted these hygienic conditions, and that had an impact on how hospitals were run in the late 1800s into the early 1900s. So we see there individuals and communication impacting positively on developments of solving infection. But infection is not solved until we get into sort of the 1860s, 70s. And actually before it got better. It actually gets worse. The problem gets worse because of the discovery of anaesthetics in 1846 and 1847. And it creates a new set of problems because it creates an era known as the Black Era. The Black Era, as it has been dubbed, is known by this title as a result of the high death rates which actually came about during the 1860s, and this was due to the fact that operations were taking place with anaesthetics and patients were effectively knocked out. That allowed doctors to go much more deeper into the human body and do much more invasive surgery. Because of this, there was more blood loss happening, but also there were deeper infections happening within the body which were not being treated and tackled, and as a result huge infections, blood infections ran rife on wards, killing huge amounts of patients. So sepsis and obviously gangrene were rife. And the big breakthrough comes in 1861 with Louis Pasteur's discovery of germs. And this discovery was so important because it fed into an individual known as Joseph Lister's investigation into why there was an increased death rate in his hospitals between 1861 and 65, so within that Black Era. And Louis Pasteur's germ theory almost gave Joseph Lister the light bulb moment for his investigation. Now, Joseph Lister in 1864, in his investigation, discovers that carbolic acid was used to kill parasites in local sewerage works. Now, because of that, he links this discovery into the knowledge that Louis Pasteur has given him on germs, and he believes and he thinks that, well, if these parasites are being killed by carbolic acid in dirty water, why can't it be used to kill these germs that Louis Pasteur is talking about on the human body in surgery? So he tests and trials this idea in 1865 when an 11-year-old boy comes into the hospital, his hospital, with a fractured leg, and the bone is actually protruding, is coming out of the skin. Now, all the bandages, all the treatment that patient is given are soaked in carbolic acid, and actually the patient, the 11-year-old boy, has zero infection whatsoever. There is no pus on his wound, and by 6 weeks he is completely fit, proving Joseph Lister's theory correct that carbolic acid could be used to kill germs. In 1867, as a result of his use of carbolic acid, Joseph Lister is actually able to promote and say that his ward is completely infection free. He has had no cases of sepsis, which is blood poisoning, on his ward at all for nearly 9 months, showing that carbolic acid is an effective antiseptic to be used in surgery as well as on wards to soak bandages, etc., in to keep wounds nice and hygienic. In 1877, he actually then shares his ideas and publishes it for other surgeons to use. But interestingly, it's nearly 10 years. It takes 10 years for him to be able to communicate those ideas. And that's because he's not accepted as a lecturer into university until 1877. So we actually see the factor of communication here slowing things down. Because Lister is unable to communicate his ideas through publications, it takes another 10 years for other surgeons to hear about how effective it is. But on the flip reverse, we've got positive factors playing here. We've got the individual of Joseph Lister and Louis Pasteur using each other's works to be able to develop a solution, a treatment to infection. And also scientific investigation methods. So Louis Pasteur uses those scientific investigation methods to identify that germs actually cause illness. but also Joseph Lister uses scientific investigation when trialling his theory that carbolic acid could be used not only in those sewerage works to kill bacteria, but also on patients in surgery. Now, this isn't the only thing that Lister contributes to surgery and reducing infection. He actually also introduces a dissolvable stitch which could be sterilised and would dissolve away in the human body. Prior to this, it was silk that was used to stitch up wounds, and there would have to be a thread protruding out, coming out of the wound, so that once the wound has healed, the silk could then be extracted, could be taken out. This could lead to further infection though. So Lister created this dissolvable stitch which could be sterilised before it went into the body and then would naturally dissolve into the system with no repercussions. Now this all seems really positive and great, so why would anyone oppose it? That's the question, because many people did still oppose Lister's really good ideas. The reasons were many people found that the carbolic acid made their hands sore. Many doctors found it actually slowed down operations, which then caused greater blood loss, and many patients died from blood loss rather than infection. Sometimes it didn't properly work, and this was largely because those doctors who did use it sometimes didn't read Lister's instructions carefully enough and therefore didn't copy him accurately, leading to death. Equipment, so the carbolic had to be carried around in tanks. This was very expensive and heavy, so was not accessible to all. And some, really, particularly in the 1860s, early 1870s, didn't believe in Louis Pasteur and germ theories. So because they didn't believe in Louis Pasteur, why would they believe in a solution to get rid of these germs they didn't believe in, therefore making to them Lister's discovery redundant? Really though, the breakthrough for those problems came in 1878 when Koch identified the specific bacterium within the body which caused blood poisoning. It was sort of the missing piece of the puzzle, as you might say, in people believing Lister and his discovery. And therefore led to people accepting that carbolic acid was an effective method to treat infection. But things didn't stop here. We have further developments in the 1890s with a move to aseptic surgery. Now, we've talked a lot here about antiseptics, so antiseptic conditions, carbolic acid being used in operations to create these antiseptic conditions. But this only killed germs that were already there. Aseptic conditions, which came about in the 1890s, created conditions and environments where there were no germs at all. And this was done by a new steam steriliser that was created in 1878 by Robert Koch, which actually sterilised equipment being used in operations. The use of rubber gloves to touch patients was very common after 1890. Masks were used over nurses' and doctors' faces to prevent bacteria coming out of mouths, and also sterilised clothes and surfaces were created to create that aseptic environment, both of which created an environment where infection was far less likely to occur in patients, and thus reducing death rates and solving that black era. The main problem though that is still left is blood loss, and that's not going to be solved until we go into the 1900s, and that's going to be further looked at in our final podcast, in our third and final podcast on blood loss. I hope you found this podcast useful on understanding how infection developed over our time period, and I hope you listen to the third and final instalment of this series.